Hi, today I especially want to talk to my pregnant mamas. I had a pregnant mama call me earlier today, and she was saying that she was having lots of pain right down in front in that pubic pelvic area. Well, what she was experiencing was pain from her pubic symphysis. That's this ligament here that connects the pubic bones together. So actually, if you feel in front, way down, the bottom bone that you can feel is your pubic bone, and you can kind of feel a little soft spot in the middle. That's your pubic symphysis. And what happens is, as we get ready to have a baby, our body produces the wonderful hormone of relaxin. And guess what that does? Exactly what it sounds like, right? It relaxes. It relaxes everything. Okay? So it relaxes all of the tendons so that those hips can do what they need to do. But at 34 weeks, you're still trying to walk around, right? You still have things to do. And so if it's too relaxed, then what happens is those hip bones move a lot freer, and then it hurts and it makes us kind of swell and makes it painful. So we don't want that to happen, right? And how do we treat that? There's not really a way to avoid it if it's already happening, if you already have that relaxin. So what we want to do is treat it. If you're going to Google it, what you want to Google is symphysis pubis dysfunction. Symphysis pubis dysfunction. That's what you want to Google. So a couple of things. First, if it's really bad, obviously talk to your doctor. Talk to your OB, your midwife, whoever you see as soon as possible. With 2 of my pregnancies, I went to physical therapy for it. And the physical therapists are wonderful. They can help all of these muscles get stronger to hold it together so that you're not relying on that ligament as much. That's what the physical therapist does. Another thing that can hold all those muscles tightly together for you is a pregnancy belt. If you have a pregnancy belt, a lot of times they're designed to kind of go over the belly and lift up the belly, but instead just wear it around your hips and kind of pull it tight like a brace. You can also use, check it out, your rebozo cloth. If you've already gotten a rebozo cloth that you're going to use for delivery, you can put that around your hips and tie it nice and tight. Here, let me see if I can do it around my model hips. See? And you can pull it nice and tight around those hips. And that's kind of another way to make a brace. It's a little bulkier than the pregnancy belt that you can put under your clothes. But so that's a big one, right? Another option is you want to keep it from adjusting as much as possible, right? So you don't want to put weight on one leg more than the other. That's going to cause friction. That's going to cause the swelling and the pain. So when you get up from a chair, then you want to keep your legs together. I'm going to demonstrate that. First of all, you're probably going to have a hard time sitting on the floor. And your pain is probably going to happen not when you're sitting, but when you try to move. So instead of just standing up like normal, where, oh, look, I put my weight on one foot and then the other, I want to make sure that I keep my knees together and stand up with my legs together so that this area stays together. Okay? When you walk, take baby steps. Don't feel like you have to take big steps. Now, I know some people who have had multiple pregnancies or have other conditions like rheumatoid arthritis and things like that, who end up having to use a walker or a wheelchair because this relaxin is so bad that they really can't move those joints at all. But for most people, if when you get out of bed in the morning, swing your legs together. When you go to sit in your car, all right, you ready? Go to sit in your car, instead of picking up one leg, because look at that. Did you see that split in my legs, in my hips? Instead of doing that, pretend like you have a little mini dress on. Sit down, swing your legs. If you need somebody to help you do that, then have somebody help you do that. Don't do anything that's going to hurt it. You can try some ice, you can try some heat. Alternating those can sometimes help. But these are all different ways. If your body enjoys those yoga poses that we've done before, you can try that cat and cow and just kind of take that pressure off. But once again, make sure that your weight is equal on both of those knees, on both of the hips. And don't be trying to lift heavy things, for sure. Don't pick up your 2-year-old. Don't do any of that. But this is what your pain is. And the good news is that it does not affect your baby. And most of the time, that pain will go away when you have the baby. So see what you can do at home to help yourself out. And then take it easy and ask for help and talk to your doctor about it as well. But that is the pubic symphysis bone or joint and the pain that you might be experiencing. So hopefully you can get a little relief. And as always, feel free, like that mama did, to call me or text me or email me or message me or whatever with any concerns about your pregnancy or your babies. I'll talk to you later.